who this Telehealth Psychologist guide is for. This guide is for people exploring whether online therapy could suit their life and needs. People living with disability seeking accessible support. NDIS participants considering telehealth psychology. Parents or carers supporting children or teens. Adults balancing work, health or caregiving. People in regional or remote areas. Anyone unsure if online therapy is right for them. What is a telehealth psychologist? Telehealth psychologists provide professional therapy through secure video or phone sessions. AHPRA-registered psychologists. Evidence-based therapies like CBT and trauma-informed care. Same professional standards as in clinic sessions, secure, confidential platforms, flexible access from home or a safe space. Who can telehealth psychology support? Telehealth psychology supports people who face barriers to in-person therapy. People living with disability, NDIS participants using capacity building supports adults experiencing anxiety, depression or burnout. Parents and carers supporting young people. People in regional or remote communities, those needing flexible appointment options. How telehealth psychology works in Australia. Telehealth psychology follows a simple, supportive process. Choose a clinic or psychologist offering telehealth, complete an intake or referral form. Book a session time that suits you. Receive a secure video or phone link. Join from a private, comfortable space. Conditions. Telehealth psychologists can help with. Telehealth psychologists support a wide range of mental health concerns: anxiety, panic and stress, depression and low mood, trauma and PTSD, OCD and sleep difficulties, relationship challenges, ADHD and neurodivergent support emotional regulation and well-being. Telehealth psychology for children, teens and families. Telehealth psychology can be adapted to support children and families. Shorter or flexible sessions for young people. Interactive tools and visual supports. Parent or carer involvement when appropriate, support for anxiety, behaviour and adjustment. Family-centred capacity building approaches. Choose an AHPRA-registered telehealth psychologist familiar with Medicare or NDIS funding. Benefits of telehealth psychologist. Telehealth psychology removes many everyday barriers to care. No travel or parking required, flexible appointment times, reduced wait times, access from home or a safe space. Continued support during illness or change, improved access for regional communities. Limitations of telehealth psychology. Telehealth works well for many people, but not every situation. Here are a few limitations of telehealth psychology: acute risk or crises, complex assessments needing face-to-face care, technology or privacy limitations. When advised by a GP or psychologist, personal preference for in-person sessions, telehealth psychologists and Medicare rebates. Many Australians can access Medicare rebated telehealth psychology. Available under the Better Access Initiative, requires a GP mental health treatment plan. Video and phone sessions are eligible. Some services offer bulk billing or concessions. Ask providers about fees and rebates up front. Tip: choose an AHPRA-registered psychologist to ensure professional standards. Telehealth psychology for NDIS participants. Telehealth psychology can support NDIS participants effectively. Suitable for self-managed or plan-managed plans. Supports capacity building goals. Helps reduce physical or sensory access barriers. Supports emotional regulation and coping skills. Requires providers familiar with NDIS language. Is telehealth psychology effective and safe? Telehealth psychology is both effective and secure. It provides evidence-based therapies show strong outcomes delivered by AHPRA-registered psychologists. Secure, encrypted platforms are used. Confidentiality and privacy laws apply. Clients can enhance privacy at home. How to choose the right telehealth psychologist. Finding the right telehealth psychologist is about fit, not perfection. Check they are AHPRA registered, experienced with your needs, and communicate in a way that feels respectful. After the first session, trust how supported and understood you feel. Preparing for your first telehealth session. A little preparation can help your first telehealth session feel calmer and more comfortable. Before your appointment, test your internet and audio, use headphones for privacy, and choose a quiet space where you feel safe. Having water or tissues nearby can help, and it's okay to write a few notes or feel nervous. You can take things at your own pace. Tip: treat your telehealth session like an in-person appointment. Give yourself quiet time before and after so you can settle in and reflect. When it might be time to reach out, you don't need to wait for a crisis to seek support. Ongoing low mood or anxiety, feeling stuck or overwhelmed, stress affecting daily life, changes in sleep or relationships, disability or health-related emotional challenges. A gentle next step with affective care. Support should feel calm, respectful, and human. At Effective Care, we offer emotionally centred, person-led support for people living with disability and families, guiding you through telehealth, Medicare, and NDIS options at your own pace. Reach out when you're ready for a conversation where you feel heard, understood, and supported.